Beat AML is a large precision medicine trial where patients get assigned to a specific genomic subgroup based on what genetic mutations they have at the time of diagnosis of their leukemia. And what I presented was the results from the S3 subgroup. The S3 subgroup is the group of patients who have mutations in IDH2, and they go on a protocol where they're given the very potent IDH2 inhibitor, Enasidenib. That's a very exciting trial because these are patients who might not have other options. These are patients who the standard of care, induction chemotherapy, probably wouldn't be good for them. It's probably too toxic for them. So in total, we enrolled 28 patients on this subarm, this sub-study. Of those 28, 27 began treatment with single-agent Enasidenib at a dose of 100 milligrams once a day. The results were rather remarkable. We saw responses in 44.4% of the patients. 7 patients had a true complete remission. 2 patients had a complete remission with partial hematologic recovery. And that's a really, really good result with a single-agent oral pill that a patient can take at home and they don't need to be hospitalized for. Really, the most significant adverse event that we saw was what's called a differentiation syndrome. So what is that? Differentiation syndrome is when the mutant IDH2 AML cells start maturing. What happens is that they can release these substances, these cytokines, which cause a non-cardiogenic pulmonary edema. It can lead to fluid accumulation in the legs, in the lungs, in the heart, and if it doesn't get jumped on right away, it can be catastrophic. So the important point here is that if you see something that looks like a differentiation syndrome, there is a quick remedy, and that is giving steroids, dexamethasone 10 milligrams twice a day, and that will get rid of the differentiation syndrome. But the important point is that you have to recognize it early. So doctors who are treating acute myeloid leukemia and giving with IDH2 mutations, giving these patients the IDH2 inhibitor Enasidenib, if they see anything that resembles this differentiation syndrome, they need to have that patient come into the clinic, be seen right away, and then start that dexamethasone if they are concerned that this really might be what it is. So in summary, very, very good overall response rate, 44.4%. Watch out for differentiation syndrome.